Welcome to the No Plan B podcast. I'm Jean-Philippe Cara, your host, and my guests are coming to this show not to sell any product, but to tell us the story. I want to know who they are, where they're coming from, what kind of kids they were. At the end of the day, we're all unique snowflakes. So let's get them here and let's learn. Welcome to the No Plan B podcast. I'm Jean-Philippe Cara. Today my guest is Daisy White. She's a health advocate and she struggled with a serious disease which is called the Lyme disease or Lyme disease, depending on the regions. She's going to explain us how she went through this process and how now she used that to help others going through the same process and recover from that. How are you?
Hi, everyone. I'm a health advocate, particularly specializing in Lyme disease. And more as time progresses, all kinds of neurological conditions as well as cancer. I had a very brief stint on The Real Housewives of Beverly Hills and sort of got well known for helping Yolanda Hadid as well as the Hadid family, as well as helped write the book Believe Me. Currently working with a doctor by the name of Kent Holtorf, and we're doing a pro bono veterans project where we're helping veterans find their way to better health with a project called My Better Medicine. And I work on average for anywhere between 30 to 40 different families that are battling all variant versions of Lyme disease or chronic complex illness. And I travel all over the world with them to variant medical facilities, getting variant medical care. I'm sort of the truffle hound of unique medical procedures and sort of an expert in overall transformation when it comes to wellness. In terms of my own journey, I myself am a Lyme patient who had a rough journey, especially with infertility as well as dental problems. And I have a wonderful adopted son.
So these are just
Yes. But I'm a stand for transformation in my own life and a stand for transformation in other people's lives, which is what I've dedicated my life to.
That's a lot of compassion, which is absolutely awesome. Daisy, thank you for that presentation. It's extensive and covers many aspects that I want to go deeper with you. I'm intrigued. I'm interested. I'm curious. At the beginning of your presentation, you stated that, let me go back to something. And Daisy is French, like I am from Paris. So yes, we could do that in French as well.
Oui.
Oui.
So, oui. So I'm a Franco-American human being. I was born and raised in France of American parents, so I grew up speaking both languages interchangeably. My sister, who passed away almost 7 years ago, lived in Paris when she passed away. And I just went to Paris last week to pick up my French passport. I had lost my original papers, and it had been many years since I had my French papers. But when my sister passed away, I felt very compelled to make sure that I was part of my original heritage as well as my American heritage. So I am now I have a dual nationality, and I have a son who goes to Lycée Français in Los Angeles, who also speaks French. He's 8.
Nice.
And he his teacher says he'll be fluent by 3rd or 4th grade, so he will also have dual nationality.
That's very cool. That is very cool. But you're still going to pay your taxes in the United States, whatever you do.
Correct.
You cannot escape that.
Thank you for stating that out loud.
I know.
We work in America and we rest in France.
Yeah. Uncle Sam is very tough on that. Anyway, so let me go back to what I was saying after this introduction and chapter. You said something that is very, very interesting for me. You had people going through the disease, but also you said a very important term, neurological disease or sickness, and you named cancer. That is solid.
Yeah.
Let's dig into that, because this is something I really want to understand where the concept of first neurological comes from, and second, how
What do you call? What is the word that you're saying? What did I say?
You said
Neurological.
Yeah, some things like that. And I was just like curious to see how cancer can be considered as the neurodegenerative or
I'm not sure that I intended to say that cancer was neurodegenerative or I'm not completely opposed to what you're saying, in the sense that, I think many people believe, particularly in the more sort of alternative side of things, that cancer is more the end stage of chronic infection. And so we talk about chronic infections in the, chronic infection community and world. We talk about a lot of chronic infections as occult infections. So occult meaning not that they're spooky, but that they're subterranean, or that they're, invisible and misunderstood. So, and so occult infections, when they're underground, hidden, not seen, can slowly degenerate tissue. And those degenerated tissue can result to cancer.
Yeah. Today we know that, we're not going to just spend our discussion on cancer, but we know that cancer is mainly some sort of erratic expression of genes that makes the cells going crazy and have a certain.
I don't know if I agree with that statement.
No, but it can be you may have a point on that, because it's triggered by many factors. It could be infection, it could be environment, it could be toxical, it could be chemical, it could be whatever. And infectious disease as well could trigger, but the result is like, okay, yeah, please tell me.
No, so obviously sort of the most, plebeian, ubiquitous theory of cancer these days is that it's genes that have been, primed, or most prominently, people have genetic predispositions towards cancer. However, not everyone with a genetic predisposition will manifest cancer. So these are things that we have to think about. However, of late, I have been working with some very brilliant people who are very into deuterinomics and deuterium depletion, and deuterium depleting the body with deuterium depleted water. And I might be speaking gibberish, but and I have worked with a few cancer patients that have employed mistletoe, as well as deuterinomics and deuterium depletion, as well as using sort of a ketogenic or carnivore based diet to continue to deplete deuterium. And they've become cancer-free. And so there's a lot to be said. There's this brilliant ND that I've been working with by the name of Petra Dorfsman, who actually lives in Europe. She's Dutch, but she, lives in Hungary. And she is doing so much research on deuterinomics, and she has written an article for the Townsend Letter that was recently published about cancer and deuterium, and it's quite fascinating.
Yeah, I like actually those water-based and this theory about deuterium. It's one. There's the theory behind stem cell. There's another theory behind infrared therapy. All sorts of therapy now today are trying to claim that they cure cancer. Matter of fact, none have really proved, except a case once in a while that for certain mystical reason they go cancer-free. But I wish that one day we're really gonna get a serious response to the cancer in general. And Daisy, my opinion on that, I believe that the only way that the cancer will be treated, it's going to be through CRISPR and derivative technologies.
Interesting. Look, I just want to clarify that I'm really by no means a cancer expert. Cancer has been something that's been way more on my radar, especially in this last year and a half, because I've been working more predominantly with cancer clients, but it hasn't been my wheelhouse or my focus. I have a much greater knowledge base with chronic infection, as well as particularly in the subset of Lyme disease. Although Lyme disease is an umbrella diagnosis in some ways for those of us who work with Lyme patients, because We look at, I like to say Lyme disease is like confetti in a very high wind.
Yeah. Wow. My God.
And,
Yeah. That's interesting. That's an interesting transposition. I like that. Yeah.
Because every person who has Lyme disease, the confetti lands differently.
Yeah.
And, then you have to sort of unravel that picture uniquely to each person. And one of the reasons why I have a function is that my job is to be the detective to help people put together their very own Rubik's Cube into their own healing journey. And so Lyme disease is not just Borrelia burgdorferi, it's Borrelia, it's Bartonella, it's Babesia, it's viral syndromes, mold toxins. And I think the good thing about the Lyme community is that it's lent a lot of knowledge to all the other communities that have needed a more focused microscope to how do we manage healing and unravel healing journeys. Yeah. And I think even in this day and age, with many people dealing with COVID, long COVID, or call it spinach.
Yeah, and the panel of symptoms are at large as well. You're right on that. Is it because this Lyme disease? Oh, sorry, Daisy. A question.
No. So
what you said. Yeah.
No, please. I didn't mean to interrupt you.
No, me neither. You're my guest. It's because the Lyme disease was ignored or is not diagnosed properly that we get to this confetti in the wind.
Well, the confetti in the wind can be used. The metaphor can be used in many different ways. Yes, confetti in the wind meaning that people are lost for a long time, but confetti in the wind meaning that they have a lot of different issues that land differently, and it doesn't make any sense to anyone. But yes, many people go undiagnosed for many, many years. It's not uncommon to meet someone that's seen 100 doctors with, multiple diagnoses and no solve. And ultimately, my role is to help people find a path. And then to manage the path, to be with them on the path, to accompany them through the path, and then hopefully get them to higher ground. But the analogy that I'm drawing between what people are going through now with long COVID as well as what people have been going through with Lyme disease is that oftentimes, like a newly diagnosed long COVID patient will talk to a long, suffering Lyme patient, and they'll be like, oh, well, we've been going through this for like 25 years. It's not like they have Schadenfreude, but it's kind of like they have Schadenfreude because it's like, well, we already know what this is like. This is not new for us. But I think the Lyme community has lent, and now everybody and their, and their best friend has a shingle saying they're kind of a Lyme advocate or a Lyme supporter or a Lyme coach or whatever, which, I was kind of on the forefront of that. But so it's interesting, but it's lent a big opening. It's given a big opening for the rest of the health community and the long COVID patients or people who are managing that, because there's a paradigm for people. Back in the day, it was like, well, it's been a month that you're sick. How come you're not better? Is there something wrong with you? And we live in a culture and in a community that has an understanding of people being sick for, let's say, a couple of weeks. And then if you're sick longer, then there's something maybe strange. But if you're sick 6 months and you don't have an answer, then maybe you're deranged. Or something like that. Exactly. And then, and then and then this goes on, and then if you have cancer, well, you might be sick, for a year, but then you might go into remission, or then you might not make it. And the culture has an understanding of these paradigms, but for a long time, people just didn't really understand people in the Lyme subset because they just had this long suffering with no resolution, and that can't be normal, so.
Yeah. And do you think that this is because our society, and especially I believe that it's more in our countries because people expect pills to cure their disease, and we don't have any vaccine, anything to help Lyme disease today, as far as I know. So maybe that is the reason why. What do you think?
Are you speaking about America or France? Because
I
don't know.
They're pretty much similar, I guess. Whatever is coming outside of East.
Yeah, no, you're right. So in America, I think, it's not that America and France are dissimilar in the sense that they're both kind of like Western, sort of prolific cultures. It's more, France is a little bit more organic, maybe in some ways that it might be managing, although it's changed a lot, certainly since our childhood, I'm sure. But in America, we have a much more sort of everything now, everything yesterday, perspective. Yeah. And in France, I think there's a little bit more leeway for people. You can take a longer lunch. So maybe you can just take a little longer.
It's true. Well, yeah, that's a good one. I like that. It's true, actually. If you go down to Italy or Spain, it's even longer then.
Yes. And yes, go to Greece and Italy, you're going to be even better. But no, we jest. But no, I mean, we're getting now into sort of a more philosophical perspective about this, but I really believe, as a person who helps people get well, I'm not a savior. I don't save anyone. I think nobody saves anyone. We save ourselves.
First, if we can,
if we can. So, I consider myself more as a midwife to someone's betterment, because my role is to keep people on track and then to help them, instill them with the understanding that they can save themselves and that they will find the path, and that I'm there to get them as their support system and or a guide, advisor, but I'm not here to save them. So, and it's tricky because especially with people with more maybe terminal or illnesses that could potentially take their lives, we don't get to decide, if someone's going to make it through or not. It's their soul is deciding, and it's their path. And it's difficult being a coach through these journeys because sometimes we might see more for a client than they can see for themselves. And we have to step back and say, okay, well, this is what they're ready for. Yeah. We're sort of just changing the subject, but
I like that. I like this direction because it's actually something that is into our actuality or world today. So in between your role and the role of psychologist or psychiatrist, maybe not. But the family doctor, like 30 years ago, they were doing this sort of job. Today, it's numbers and patient that they have to see, but used to be a bit like that. So you consider yourself like more some sort of a coach in this case?
Well, first of all, I have to say I don't have a medical license. Mm-hmm. I'm not medically licensed. I have a lot of certifications. I'm certified in autonomic response testing.
Curious if you can explain. Yeah. Could you explain what it is, please?
Dr. Dietrich Klinghardt is one of my great mentors and a great human and a great person and a great doctor. And he was my doctor. He is my doctor, but he's also a mentor of mine and a brilliant man who's given so much to so many of us. In terms of what he generously teaches us and all of his patients and all of his quote-unquote disciples. And he invented this form of applied kinesiology called autonomic response testing, where he uses a light refracting unit and a pull filter to refract light into the body, and then uses variant tools, frequencies, vials, CDs of different illnesses to use direct resonance, and then to see it's a diagnostic technique as well as a technique to teach us how and what each person might need treatment. And autonomic response testing is a little bit complicated. It's not like straight muscle testing where it's just like yes, no, because there's a lot of different levels and layers and stuff, and it takes a while to learn. And I've managed probably over 200 patients with him as the doctor, as their advocate, and have learned so much. And so it's an amazing tool. It's an amazing technique. And I am trained and certified by Dietrich in this method. There is a protocol then
behind this technique to be able to. Okay, that's
you mean in
interesting.
terms of the certification or in terms
No,
of doing the work?
Yeah, I think doing the work, like when you said you make diagnostic. I'm a true believer into vibrance and frequencies and things like that. I think that we're just like discovering the potential of these things. And I'm curious to see.
I mean, it's an amazing tool, particularly for people who have complex illnesses, because well, first of all, there haven't been great diagnostics, although it's improved, and there's certainly some that I can name for Lyme disease, iGenX, and Armin Labs in Germany, and Armin is a very good friend. He has a great laboratory for testing, and obviously the conventional testing fails all Lyme patients, but using applied kinesiology, even if it's straight applied kinesiology like nutrition response, but particularly autonomic response testing, is extremely helpful for patients who have often feel like they've lost their way. They don't have a compass anymore. They've seen so many doctors. They've lost faith in their own healing, and they've lost faith in their own body and in the medical community. So they have to rebuild that in order to find their way to healing. And so autonomic response testing is an amazing tool for that. And to answer your original question about, what do I consider myself? I mean, I don't even really know how to name what it is that I do, other than I've, been coined as a health advocate because it's something that didn't really exist when I first began doing it. But I wear so many hats. I'm sometimes a travel agent, sometimes a travel concierge, sometimes. I'm a protocol police. I coordinate and manage the care between sometimes 10 different doctors, and I teach the patients, well, this is your executive chef, and I'm the sous chef, but these are guest chefs. So my job is very multi-dimensional, multi-dynamic. There's not one thing that I do. I'm the protocol police, like in between appointments. Sometimes I manage all the refills for patients. I sometimes tell them where to get things that they can't find anywhere else but in various countries, like strange products that nobody's ever heard of. So it's a very unique, multidimensional, and yes, I'm not medically licensed, although I have certifications. And there are many doctors that I work with that will tease and call me, and I like to say this publicly, they tease me and call me Dr. Daisy. However, I do not allow them to call me doctor because I'm not a doctor, and I will not impersonate a medical professional, nor do I pretend to be a doctor.
Today the title lost a bit of this credibility. I think they're on board. My whole family are doctors, but with all due respect and love, unfortunately, the doctor title lost so much in the recent years, especially after COVID, because of the non-response and the non-capability of taking risk, the risk to die in a certain way, and just to taking the patient as like, I'm dropping one ball to another doctor, to another field. I think that there is a big work to be done on that side.
Exactly. And so in some ways, like you mentioned about 30 years ago, let's even go 50 years ago, the country, the family doctor, that function has been very diminished in our culture today.
Yeah.
And this is why there's become a niche and a function for someone like me, because there's just not enough handholding and not enough education. So my job is part education, part support, part management, and clerical part. So there's many different aspects to it. And back in the day, there would have been a much more cozy and insulated medical community that just doesn't exist in our day.
No. The doctors in the past were spending time with their patients, talking about their problem more than the illness that they were called for. And at the end of the day, they were discovering so many aspects of their personal life that could impact whatever they had, like allergies or bad digestion or expression of certain genetic factors. Today, since they have to go fast and make more money for more passion to be seen, it's a different story. And most of them, they don't want to take any diagnostic to the end because they are scared about being the one that pinpoint what is going on. So they refer to specialists, and specialists, they refer to hospital, and it's a never-ending story. But anyway, what I like in the fact that you have all these techniques and approach to kind of diagnose some things that was really hard to be diagnosed or to be found in the medical community. I'm thinking out loud now. Do you believe that maybe if all these guys that you have around you and your knowledge could be transposed in the world of tomorrow, and getting artificial intelligence in this process to compile all these data that you have there and help the medical field to come up with a certain tool that could be used universally?
Yes.
Yeah.
Unfortunately, medicine. I mean, I'm quoting my mentor, Dr. Klinghardt. I mean, he will say this. Unfortunately, medicine is broken. And, it's a difficult topic to talk about out loud in today's culture with everything that's been going on, and censorship around what can't be spoken about. But ultimately, I think, we're at the mercy of, let's just take cancer for an example, because it's something that we can talk about without getting too much in trouble. But, there is there's a, how do you say it? Engrenage. There's
now that you ask, of course, I don't find the name either.
I know. There's a machinery that's set up in our culture where, it works a particular way. And the cancer world's a really good example because, you get diagnosed with cancer. Of course, you're going to go to oncology, you're going to go to surgery, you're going to, there's chemo, radiation, there's a particular protocol. And those protocols, don't really necessarily have anything to do with healing. They have to do with medicine, and they have to do with what medicine knows. But oftentimes in those machineries and in those protocols, people feel very lost. It's not really individualized. It's fairly cookie cutter. And it's often serving a greater purpose in terms of financial gain than it is, serving the purpose of the patient's needs, and unfortunately there are examples of this in the medical community everywhere. And I'm not saying that people involved in medicine shouldn't make money or shouldn't make a living or shouldn't make a profit. I mean, we're all here, everyone needs to make a living. But there are ratios, to these things. And then there, and it's complicated because there are many people who are sick and who feel that, the world should be, medicine should be free, or we should all be Florence Nightingale. And unfortunately, none of us can work for free. We come from a country where there's a lot more social services around medicine. And I would have to say, because my sister died of cancer, or late stage cancer, and had
a long process too, I think.
Yes, 33 to 49. So, but she had full medical coverage in France, and I don't see many countries that have good medical care the way France does in that regard. You see that in France, if you need to go to a hospital, you get a car service and it's covered.
You don't wait.
It's a different system, and it's different than all the social systems in the world. I mean, like I do, France is unique.
But they pay the price for that. Economically speaking, they pay high price, which was
high. Very, very high price
of this country. But my point on that, Daisy, we spend so much in arms and killing people, and if we just put that money into healing people, that would be a better world already. That is already a good step to take. But anyway,
I mean, there's so much, Jean. There's so much to talk about in relationship to how can we actually serve humanity versus, serve a revenue-based medical culture. They're two different conversations, in my opinion. I do my best, to make a living and serve humanity as much as I can, and to try to stay balanced in the two. But it's not an easy battle in anyone's life or in the world that we live in today.
Because you put your finger on something that is very serious, actually. Medicine, as it is today, has a lack of compassion for people. So what you bring is probably a lot of compassion, understanding, and helping, which our medicine, our system is just like sterile. It's empty. It's like you are a number and you have this. Now deal with it. But the psychological factor behind it, no one cares. So thanks God there's people like you.
No.
Yeah.
Well, thank you for that. Well, one of my goals actually is to train more of me with accreditation and potentially, because I do think there's a dearth of what I do, and there are people that sort of hang a shingle and do it, but I think people need to be educated properly because it can be a little bit dangerous to sort of give random advice. But that's a whole other conversation. And I might be going too deep into, and you can stop me. But
No, please.
it's in my bio, and I speak about it very openly. I mean, I had a very difficult childhood, had a very difficult upbringing, unfortunately, but I'm a bit of a miracle, and I have no qualms saying that because I don't know a lot of people who've had the kind of childhood that I've had and come out.
Yeah, you went against.
And we can talk about it, and I'm happy to talk about it. But when you talk about, compassion and humanity, I mean, I wrote a one-woman show about my life called Sugar, where I express all this, and I had a wonderful mentor at the time who is a very well-known acting teacher, and also, I wrote my show and I played it. I played 38 different characters, and it's something that I want to do more of, not necessarily the show, but more speaking, educating, and also speaking from this place. But as time unravels in my life. But what I was trying to say is that because of my upbringing, and there was a lot of loneliness for me growing up because I had parents that really didn't love being parents, and I lived alone very young when I was 13. And then I was in the fashion industry as a child model, and unfortunately, I was a victim of sexual abuse or misconduct very early on in my life, and paid for sex when I was 13, 14, before I even really knew what it was or what even prostitution was. And it led me through a path of being mishandled and misused and objectified, and then I, as a young woman, got into high class prostitution. I think as a necessary journey to healing.
But how do you build yourself in that? Because that is one path. But on the other side, you're 13, you have to build yourself. Yeah.
Right. And so that was, it was like gravity. That was sort of all I knew. But anyway, and that's a very long, that's a dive we can do because I'm giving you kind of the bullet point of that. But what I wanted to say in relationship to that, because of what you were saying, and I know, when I was working on my one-woman show, people often ask, like, how is this true and how is this possible? But there was this thing that happened to me when I was, actively prostituting myself as a high-class call girl, where it really wasn't about, the sexual interaction, but it was about that moment of loneliness for a person who, was hiring this other person to care for them in an hour of time or 2 hours of time, where there was this moment of connection. And oftentimes it was more the conversation or more about, their recent divorce or whatever it was. And it was this moment of connecting humanity to humanity. And, people were like, well, what are you, the hooker with the golden heart? And I was like, well, yes, actually, that because my own loneliness had been so impacted as a child that sometimes, although for me, the sexual component, the sexual part was irrelevant or inconsequential, it was about these moments of encounter that had a healing aspect. And one of the reasons on myself as well. Exactly. And so sometimes when I would leave, my heart was full because, and it sounds hokey, but my heart was full because this person had been seen or I had been seen. And so I think I learned then that the gift of presence is very powerful. And so when I learned, sort of happened into advocacy through just being able to show up and be of service, because when I was after I came out of prostitution and I had been stung in a sting operation by the LAPD Vice Department, and I had to testify against the madam I worked for, which is a whole other dramatic conversation in my life. But I had dressed up as, like in a disguise, and I had like a dark wig, and I was wearing like thrift store clothes, and they were like, I had an immunity deal so I could speak about my life without having to go to jail myself. So, and of course I was a pawn for the judicial system. And I had this epiphany when I was on the witness stand, where everybody was saying, well, she can say this and she can't say that. And, they were in chambers saying, well, she can't talk about her 13-year-old stuff because then she'll occur as sympathetic and we don't want that. And I had this epiphany that, like, why am I hiding?
Yeah.
I have to contribute this. And then I came the next day, as myself with my bright blonde hair and my clothes. And people were like, who are you? And I was like, and the judge was like, how are you doing, Miss White? Are you feeling better today? And I said, yes, a little bit more like myself.
Awesome.
And then I just won the jury, and just was like, okay, I have to serve humanity. Because I don't have to be ashamed. I have to be a contribution.
Yeah.
And that changed my life, forever, essentially. And so, which is what, now, so the thing about Dietrich, and I know I'm speaking, I'm opening a lot of icons. No worries. So what it is, so Dietrich, I think, as a doctor, he has this humanity. And he has this gift of presence. And, when he was my doctor, and we have a wonderfully platonic, almost familial relationship, And when he was my doctor, I think we understood this about each other, and he understood my history, and he understood that it was more the history of a healer, and never, there was no judgment or shame about it. And he understood that the presence and the gift of presence that I had then, I still have. I've just translated it into something much more powerful and healing to even myself, and there are moments now when I'm, potentially traveling with a person who's struggling with their health, and I'm sitting by their bedside, and that same encounter or that same humanity exchange is reminiscent for me.
What is beautiful, Daisy, on what you said is, I think that today people on this planet just neglect one simple thing: talking to others. Most of the time, we don't even say hi to anybody in an elevator in the same building, even your neighbors. I speak to everybody, even in the street. There's bump asking for money. I'm always asking them, why are you here? What happened to your life? Of course, there is this dementia or sickness or psychiatric issue behind many of them. But at the end of the day, all humans deserve some sort of attention. And when you bring this attention to any human, whatever he is, whoever he is, you see some sort of sparkling light coming up of these people that were probably looking for just a bit of attention or understanding or just like listening. And this is what you do. So I love it. I truly love that approach. Now that explains very well what me and health advocate. It's exactly you. Yeah. That's cool. That's very cool. Can you explain our audience, what is the Lyme disease? What are the symptoms? Mm-hmm. Many, I'm sure they're going to have to Google it. I know because I've been living near to the wood and lakes, so I know where it's coming from. But please, if you take 2 minutes or 3 minutes to talk about it, that would be greatly appreciated.
Certainly. So Lyme disease is very well understood or known about when people refer to Lyme disease and tick-borne illness. Mm-hmm. People are like, Lyme disease, is that from ticks? Unfortunately, it's not just from ticks. In the Lyme world, we don't call it tick-borne, and we actually call it vector-borne, because anything that's a vector into the body, it potentially can carry Lyme. And that's, unfortunately, it's all insects. It's definitely, it's also...
vector means transporter,
correct? A vector, a vector into the body, right? And there are multiple vectors. If you think about it that way, obviously there's, recluse spiders, there's any kind of spider bites, there's fleas, there's mosquitoes, anything that can bite you. But then there is also the vertical transmission. So mother to child is another vector, and then partner to partner. So this is very controversial because then we start to look at an epidemic. And in the Lyme world, we believe that there is an epidemic. The conventional medical world or the conventional medical community doesn't really believe in late stage or chronic Lyme. And that's a whole other conversation. But Lyme disease is essentially the Lyme bacteria that everybody knows about is Borrelia burgdorferi, Borrelia, and but Borrelia is like a bad teenager because it likes to have a party with all of its friends. and drink all of your booze and not even tell you that it was ever there. So, so we have to look at, a complete picture. And Lyme disease or Borrelia comes with a lot of other bacteria, as well as a lot of other viruses, as well as fungal issues and other parasitic issues. And Dietrich calls Lyme disease AIDS minor. And in that sense, he means that there is an opportunistic infection that comes and co-ops your immune system and weakens it to a certain extent that all these other, infections can come and set up residence in your body. Now, it is often a way of looking at the body and at illness from many, many aspects. So we look at it from a toxin issue. We have to look at what toxins are there.
If you allow me just to say, it's a bacteria. We know how to kill bacteria since Pasteur from France.
Well, Borrelia is a bacteria,
but it's the toxin.
It's a spirochete.
Yeah, that's
it's a spirochete. So a spirochete is like a corkscrew genus, and the other corkscrew that we know well is syphilis. Mm-hmm. So that's that genus or genus of bacteria. But it doesn't come only with bacteria. So it comes, so Borrelia is a bacteria, Bartonella is a bacteria. They often come together, and it's also called cat scratch disease or cat scratch fever. Sure. Then there's Babesia, which is a parasite. It's a blood parasite, which infects the red blood cell. And then those are the sort of the highlights. But then it often comes with Epstein-Barr, which is virus related. And then it can come with variant molds and candida. And then some of the things that you use to treat these things can cause more mold, more candida.
That's the problem. Yeah, it's because it's so complex that one treatment can trigger another symptom or syndrome.
Exactly.
And this is why. And let's list, just for the fun of it, a couple of the symptoms that you have, that you may have or develop during Lyme disease. They go from anywhere from headache to cramps.
They're very varied. Everyone has their own version. Headaches, chronic headaches, fatigue, inability to sleep, but insomnia, but exhaustion, brain fog, pain syndrome, aches and pains, arthritic pain. Sometimes joint issues, severe joint issues where people limp or need hip replacement surgery because Lyme bacteria can set up into the joints. It likes to eat away at your collagen. I personally had this very strange symptom for many, many years, which was like a weird, I used to call it like a pinball machine of pain because it was a migratory stabbing pain syndrome. For many years, it terrified me. And now it's almost like, oh, I used to have that. It's like childbirth, I guess you can forget true. These things.
Well, you can talk for hours about childbirth, and because you went through a serious process there as well.
Mm-hmm. Yeah, so unfortunately for me, my chronic health issues impacted my fertility, whether it was Lyme disease, whether it was my early sexual abuse. I think, I had salpingitis. I had pyelonephritis as a child. So, well, you can say I was a child because I was 14, 15. Yeah. It's hard to say exactly how and where my fertility was claimed on some level. That makes me emotional.
Please.
But I have an amazing son, and I had we had the misfortune, my husband and I, of living through 20 plus pregnancy loss or pregnancy mishaps.
The resilience to go through that. People that go through one or two are suffering for the rest of their life. You 21 times.
I have enormous resilience, period.
Yeah, I can bet.
Because of everything I've transformed through, including losing most of my teeth and having them all rebuilt. So I have a completely reconstructed mouth. And I'm still in the process of finishing the reconstruction of my mouth, which is another conversation we can dig into. However, my husband and I have an amazing husband and a wonderful marriage, and I'm so lucky. Given my history, that's true for me. But I wanted nothing less than true partnership, given the history that I had, and I fought for that. So, but there is a field of fertility and that is not very well understood, called reproductive immunology. And there are a couple of doctors that sort of are on the forefront of reproductive immunology, and sort of it intersects reproductive issues for infertility, fertility, and immunology. And it's quite extensive field of research. And there was a wonderful doctor in New York named Dr. Braverman who passed away not long ago, who did amazing work with women who had recurrent pregnancy loss. But Lyme disease and infertility have a lot in common. And, chronic infections. And there have been a few OBGYNs that have been brave enough to go down that path. So anyway, I was lucky. We were lucky enough to find. We really didn't plan adoption. In fact, I was extremely determined to be pregnant and give birth, whether it was my own egg or my, a donor egg or a donor embryo. We did all of those things. But Jazz, our son, sort of found us in a different way. And we found through Facebook, actually, through a mutual friend on Facebook, the birth mom of Jazz, who has cerebral palsy. And we met her when she was 10 weeks along. And she was in some ways a case that I advocated for at the same time as her being the birth mother of our son, because I took care of her throughout her entire pregnancy, used muscle testing, applied kinesiology to find out how she was doing, to find out how her son was doing, to find out who the actual birth father was, because there were multiple options, and get her through gestational diabetes, and also advocate for her to get an epidural in spite of cerebral palsy in the hospital, had a doula for her, and then got her social services on the other side so she could have social services because she has cerebral palsy. So it was kind of an amazing experience. I breastfed our son as an adoptive mom straight from the womb, which was also kind of amazing. And we have this amazing bond, obviously, as a result of that. I learned a lot. Yeah. And then I got donor milk from moms all over the country for 2 years. And he was breastfed for 2 whole years. So and has an amazing immune system because he was breastfed by. Yeah. So, I mean, I wouldn't have it any other way. I feel that way about everything about my life. Not that I don't have emotion around some of the things, that didn't maybe manifest, but I'm also incredibly grateful that I've been able to chart all these paths for myself and the uniqueness of my life. Yeah, it has been a gift for myself and for
yeah, I don't think there's many people with the same life. I don't think so.
No, Jean, definitely not.
So, many people would be interested in this, learning about this whole journey of your life. How could we guide them to learn more about you? Do you have any, I know your website will be listed, of course, your Instagram account and everything, but any other places they can go and find this fascinating life that you've been going through?
So I'm going to be probably doing a podcast with Kent Holtworth, who's a very well-known Lyme literate doctor. We're trying to put together a podcast because we're kind of a funny duo. We're both kind of weird. And that will be something to announce. I wrote this, actually quite proud of this one woman show that I wrote called Sugar. And I don't really want to be an actress anymore. The entertainment industry put me too much into what I overcame in terms of objectification, and it's just not for me. But I do want to start speaking more. I did speak at the Ozone Conference a few years ago, and definitely want to educate more about transformation, about health, and certainly about courage, because that's something I know a lot about. Yes. If I'm not a victim, then you don't have to be.
Yeah, exactly. And that's excellent. But maybe you should do, I don't know, today with the social media exposure that you can get, like short page on your story chapters that you could do on YouTube, or just talking alone, not with somebody, but about your story could be something that people would be definitely interested to watch or to listen to. You don't need to be invited by someone asking you question or not. I think that you have so much to say that you could do it like for hours. My tip.
Well, Jean, I really appreciate that insight. And I'm open to those kinds of suggestions, and I appreciate you telling me that. And yeah, that's a great idea. So I'm open to your ideas. I'm always available to understand and to learn and to look at more unique ways to contribute. I think it's really true, and I think if anybody is feeling lost, and I know a lot of people are feeling lost these days, especially after 3 years of having so much isolation for so many people, that contribution and being of service can really change that. And I myself go through periods where, I have the blues, let's say,
But you're human, of course.
I'm human. I've tended towards melancholy, and I've used ketamine-assisted psychotherapy to help a lot. But I know that when I go there, oftentimes, if I just get back on the horse and think of where can I be of service, that really helps me, and I hope that can help others too.
That's beautiful. Great. Yeah. Very, very cool. Daisy, it was a great pleasure having you here. We went from all sort of topic, high, down, up, whatever. It was very interesting. It's intriguing. And honestly, there's some things to be done with your life, to be exposed, to be known by others that are like just lost because they don't know. They're going into those phases that you've been into your life, and they're there and they don't know who to call, who to speak to, who to learn from. You're there. Do it. You're going to help our world even more than what you already do. So thank you so much. Thank you, Daisy. It was a great pleasure.
Thank you for having me. I'm very grateful. Thank you for having me.
Thank you.